Hello everyone, I'm Dr. Megha. Welcome back to my channel. In today's video, we'll be talking about benzoyl peroxide, especially about Benza KC 2.5, which contains 2.5% of benzoyl peroxide. And in today's video, we'll be talking about what actually is benzoyl peroxide, how to use it, what percentage of benzoyl peroxide should we be using, and also we'll be covering about who should use it, who should not use it, what are the side effects of it, and also some few mistakes which you need to avoid while using benzoyl peroxide. So without any further ado, let's get started with this video now. So let's see what actually is benzoyl peroxide. So it's a topical anti-acne treatment which helps in reducing inflammatory acne like cystic acne, pustules or pus-filled acne, also mild comedonal acne like whiteheads and blackheads, and even helps in treating body acne like butt acne or back acne. So benzoyl peroxide is available in different percentage like 2.5 percentage, which I have it right now, and it also comes in 5 percentage and also 10% as well. And in today's video I'll be talking about 2.5 percentage of benzoyl peroxide. So let's see how it actually works. So before you understand how benzoyl peroxide works, let me tell you how actually acne happens. So acne happens when the pores of your skin gets clogged due to excessive oil or dead skin cells. Then bacteria grows inside the pores and that particular area of your skin gets inflamed, then acne is formed. In that case, benzoyl peroxide works in 3 stages. First, it helps in killing acne causing bacteria, which is Cutibacterium acnes. Second step, it reduces inflammation, which helps in calming the skin down, calming the redness and irritation down. And the third stage is, as it's an exfoliating agent, it helps in removing excessive oil or dead skin cells from the skin. So in this way, it helps in reducing acne and also helps in preventing new acne from forming. So this is how benzoyl peroxide helps in reducing acne. So now let's see how much percentage of benzoyl peroxide should we be using. We can start by using 2.5% of benzoyl peroxide. So many people think that higher percentage of benzoyl peroxide works better. So nothing that sort. Lower strength like 2.5 percentage of benzoyl peroxide also works the same way like 10% of benzoyl peroxide. So 2.5% for beginners is more than enough. So now let's see how to use benzoyl peroxide. So you need to use this ointment at night, only at night, not in the daytime. 2 to 3 times a week at night in the beginning is more than enough. So after washing your face with a gentle cleanser, wait for 1 minute, let your skin dry completely. Take little amount of benzoyl peroxide and apply it as a spot treatment wherever you have acne and not on your whole face. Later, leave it for 1 or 2 minutes, then apply a good moisturizer on top. This is how benzoyl peroxide should be used. But if you have sensitive skin type or dry skin, how you need to be using it is, first wash your face, apply this gel, let it sit on your skin for 10 to 15 minutes, then you can wash it off with plain water, then apply moisturizer. This way you can use the ointment safely and your skin will also not get irritated. Now let's see who should not be using this gel. So people who have extremely dry skin, extremely sensitive skin, or people with eczema prone skin or dermatitis, and lactating mothers and in pregnancy, you should not be using this ointment. And also if you're using any strong actives in your nighttime skincare routine, then too you need to be not using this ointment. Let's say if you're using retinoids or if you're using lactic acid, glycolic acid, you should not be mixing benzoyl peroxide with any of your acids. You should only be using benzoyl peroxide in your nighttime skincare routine without mixing it with any other actives or vitamin C serum. Please keep that in your mind. And one more important thing is, do patch test this before using it on your face, behind your ear, and see if this doesn't cause any irritation. Then you can definitely apply it on your face. Okay, now let me tell you one beautiful thing about benzoyl peroxide. Unlike other antibiotics, this doesn't cause resistance. Yes, you heard that right. When you start taking any oral antibiotics or when you start applying any antibiotic cream or ointments on your skin, after some time it tends to cause resistance, and then that particular antibiotic stops working on your skin. But in this case, benzoyl peroxide doesn't cause antibiotic resistance, so you can use this ointment for a longer duration. So that was one amazing thing about benzoyl peroxide. Now let's see what are the side effects of using benzoyl peroxide. Like any other acne treatment, even this has mild to moderate side effects. So once you start using it, it can cause mild irritation, mild tingling sensation, or it can cause a little redness, can make your skin a little drier. It can cause a little peeling also in the beginning once you start using this cream. So don't worry about it. Once your skin settles down, these symptoms will also reduce. And one more thing, as this is an exfoliating cream, your skin tends to get a little sensitive to sunlight. So make sure to use a good broad spectrum sunscreen in the morning. So everybody's favorite question, when to expect results while using benzoyl peroxide. So it takes around 1 to 2 weeks to show good results on your skin. If you have severe acne, it will take around 3 to 4 weeks to show results. So make sure to use this cream consistently. You'll definitely see good results. So my take on this product is it's a very beginner friendly cream. If you're a beginner and you want to start using any acne treatment, you can definitely go for this ointment. Make sure to use it consistently, patch test it, and you will definitely see good results using this. So that's about it for this video. If you found this video helpful, do like, share and subscribe for more. And if you have any doubts regarding anything in this video, do let me know in the comment section. I'll be happy to help. And I'll see you next time. Until then, take care. Bye.